Hello everyone, my name's Jane Beach. I'm the Lead Professional Officer with Unite. Welcome to our Facebook Live session this afternoon, and thank you for allowing us into your home, work, garden, wherever you're watching us this afternoon on what is a very warm day. We are all melting here. Whether you're listening live or on catch up, we hope you're keeping safe and well. And today we're talking all things regulation. And I'm very pleased to say we've got a very esteemed panel here with us this afternoon to answer your questions. If you haven't sent questions in already, you can comment on Facebook or you can tweet, use the hashtag UIHLive, and please join in the conversation. So what I'll do is ask the panel if they can introduce themselves, and I'll go according to who I can see on my screen. So Geraldine, can I start with you, please?
Yes, Jane. Hello, everybody. My name is Geraldine Walters, and I'm the Director of Professional Practice at the Nursing and Midwifery Council.
Paul.
Thanks, Jane. Good afternoon, everybody. My name is Paul Johnson. I'm an Assistant Director the Professional Regulation Director at the Nursing and Midwifery Council.
Linda.
Hi, Jane. Hi, everyone. My name is Linda Everet. I'm Assistant Director in Professional Regulation at the Nursing and Midwifery Council.
Katherine.
Thanks, Jane. Hello, everyone. I'm Katherine Timms, Head of Policy and Standards at the Health and Care Professions Council.
Laura.
Hi everyone, I'm Laura Coffey. I'm the Head of Fitness to Practice at the Health and Care Professions Council.
And Natalie.
Thanks, Jane. Hi everyone, I'm Natalie Berrie, Registration Manager in the Registration Department at the Health and Care Professions Council.
Brilliant. So thank you, everyone. By way of background, why we're here this afternoon, along with the other trade unions and professional body colleagues, we've been working very closely together on the regulatory response to COVID-19. So since the beginning of the pandemic, which seems a long time ago, I'm sure you'll agree. So for example, we've worked with the regulators on establishing temporary registers, increasing the numbers in the workforce, amendments to the education standards for students, and changes to fitness to practice processes, for example, virtual hearings. So where we are now, really, the focus has shifted to how we return to some kind of normal. And we thought it was a good opportunity to provide you with an opportunity to engage in the conversations that are taking place. Because obviously at the very beginning, it was very frantic, a lot had to be done in quite a short time. So there wasn't the opportunity perhaps to engage with our members as we would have liked to do so. I'm very pleased to say that we have had a lot of questions submitted by email. So thank you very much if you have submitted one. Dave Munday will also be keeping an eye on our social media channels behind the scenes. So please let us know if you've got any questions, comments, and if time allows, we will try and cover these as well. Obviously, if we're not able to, we will ensure you do get a response. So we'll sort that towards the end. Obviously, we're not able to deal with individual cases, so particularly around fitness to practice, but you can speak and you should be speaking to your local Unite regional officer. So without further ado, I think we will start with the first question. And we've had a question for the HCPC from Graham, but we had a very similar one from the Institute of Biomedical Science in Scotland, their committee. So what I'll do is go through that, and thank you both for submitting those questions, really good questions. The essence of them are that as registrants, they are registered with the HCPC and they have to prove their fitness to practice at regular intervals. And as biomedical scientists, the laboratories they work in have to demonstrate that they're at a standard that meets ISO regulations. So what they're both asking really, with the advent of kind of pop-up private facilities in both the UK and abroad, so Lighthouse Labs, what they're asking is, what is the HCPC's role here in terms of, are those staff regulated with you, and do you have a role in kind of looking at personal standards and laboratory standards. So are you able, to satisfy that actually staff are carrying out the tests in those laboratories up to the, appropriate requirements and are they being validated and reported? So who would like to take that question? That's quite a big question, really, but it encompasses a lot. But who would like to start? Because I'm sure it will be a few of you, really. Would that be you, Katherine? Lovely, thank you.
So just to give a bit of context, the Health and Care Professions Council is a professional regulator. So we regulate 15 different professions and we set standards for those professionals. So if you are registered with us, you must meet our standards. And should you be registered with us and working in one of those facilities, we would still expect you to meet those standards. That said, we don't have any remit over the over systems-based regulation. So the CQC, the Care Quality Commission, is the organisation who would oversee that. And certainly those diagnostic and screening procedures are a regulated activity. So it's for them to oversee that side of things. We have had recent discussions with the Chief Allied Health Professions Officers across the UK, and these laboratories came up in conversation, and we do have some concerns about the measures in place to ensure patient safety in that regard. And whilst it's not within our remit, it is something that impacts our registrants. So our Chief Executive is committed to discussing that with the Department of Health and seeing what actions that we can take or measures and steps we can take to facilitate safe and effective practice in that regard, obviously within the confines of our remit.
Yeah, so it's probably, a good opportunity maybe to talk about, what is the purpose of healthcare regulation? So, and as you've alluded to there, it's about regulating individuals more than it's not regulating systems, is it? But, there is a kind of tension how those two work together. And, it's a real difficulty, isn't it, for registrants when they've got concerns about the service they're working in. So, both of those questions really strikes you that it's, it is registrants raising concerns, which is absolutely what they should do. And I'm sure there are NMC registrants that would be in a similar situation. So what's your role in helping and supporting registrants to raise concerns about things like that? And where, in this particular situation, Katherine, did the concerns come from registrants that have made you as an organisation look into it? Or I know you maybe can't go into too much detail, but...
No, so we have had some concerns, fairly limited so far, but we have had some concerns raised by registrants, and we do have a lot of resources on our website to support people through raising concerns, which is set out in the standards. And what we would expect is, in the first instance, they would raise that with their line manager. And should that not be dealt with sufficiently, then they should follow the appropriate escalation processes in their employment setting. If they have additional concerns that they think fall within professional regulation, then they should be raising those directly with us. A system regulation issue, there are some challenges around raising individual concerns with the CQC, and we recognise that can be troublesome. So I would encourage any HCPC registrant that has concerns about that to talk that through with the policy team at the HCPC, and we can explore different avenues to resolve matters. And an example of that is what I was talking about. These issues have come to light, and whilst not necessarily within our remit, we do have levers with which to be able to support change in that area, and we will use those as far as possible. I would just like to highlight that we've got a wealth of information on our website, particularly in relation to COVID, and we do have an information sheet specifically about raising concerns in the current climate, because we do appreciate that this is not an easy set of circumstances, and raising concerns in a normal circumstance is a challenging thing for an individual to do. So So use all the resources that we have available on our website, and just get in touch with us if you're struggling to sort of navigate your way through those.
Brilliant, that's really good advice. And would the same apply with the NMC? If you've got registrants that have concerns, are they able to, bring them to you? And
Want me to answer that?
Yeah, would you, Geraldine? Thank you.
Yeah, I mean, I think we've had a great response there from HCPC, and similarly, it's sort of in our code that people need to be mindful of speaking up if they're worried about something. Again, we'd say try your line manager, try your professional lead first. I think the other things are most organisations now have to have a freedom to speak up guardian, which enables you to raise concerns in a little bit more of a safer space. Part of our new education standards for people who are training to become professionals is really focused on how you build that confidence to speak up, and how you can best use your own information and intelligence to make your speaking up more effective, if you like, and how to make a good argument. So we're also interested in how we develop those skills in our registrants. They can always come to us. I think the issue there is because, as the other regulators will say, we don't really have any powers over your employer. So we can't directly do anything about it. Now, one thing that we can do is share information between regulators. So whereas we can provide advice, I think we wouldn't like registrants to think if they report something to us, we can automatically put it right, because we don't have the powers to do that. So again, it's very much along the lines of support, signposting people to sources of support and best action to take using our guidance. But I think most of all, don't feel that you can't do anything about it. If you are really worried about something, keep trying and keep seeking support from what's there in order to make your point.
And obviously I would add to that. Oh, sorry, Paul, go on.
Sorry, Jane. So, I mean, as Jerry said, there's lots of information out there. We've got some, hopefully, really clear sort of like signposting on our website in terms of different organisations who may be able to help, who may be able to support, and who may be a better place to do something if you want to raise a concern with them. On the wider issue of sharing information and sharing intelligence, one of the things that we are looking to develop, which will be of support over the medium to longer term, is that approach to sharing intelligence with our with the systems regulators. And there's a lot of work going on there, which we're really confident will be of benefit as we go forward.
Brilliant. And I must admit, this is something I've been raising for a while from a union point of view, because obviously we say to our members, yes, you follow the process in the organisation, but don't forget, you can get the support of your local representative or your regional officer or your professional officer. But, I've been saying at a strategic level, it would be really useful for us to be able to feed in some of the intelligence we have, particularly the situation described here in a way is a kind of it is a political decision, isn't it, to privatise the services. So we can kind of influence that. But we have a really useful role in intelligence gathering as unions, because we often are the first people that pick up where there are issues about services. So I'll put another plea in that it would be really good to be part of that process. So I was having a conversation with the National Guardian's Office and raised that as well. So a brilliant question, both. I hope that has provided some reassurance that actually the HCPC are aware of this issue and are looking into it. And I think it's really useful for registrants that are raising concerns to know that the regulator is listening and is acting on it. So watch this space and come back to us if we can do any more. I think it's also really important for them to raise it with you, because that's the context in which people are working. So obviously later we will be talking about fitness to practice, but you know, that's often, if things go wrong, it's because of the context, not necessarily because of the individuals. So it's very important. So, right, I'll carry on to the next question then. So we've got another question. We've got 2 questions really related around students. So I'll go to the first one, which is from HCPC, and that's from Kate. So again, thank you very much, Kate, for the question. Really good question. And Kate says she's a first-year student paramedic, and due to the pandemic, she's missed a 12-week placement. So what will happen to this? And I think, is this Natalie? I've probably forgotten who I'm supposed to go to. Oh, is that Katherine?
Yeah.
Okay. It's easier, I think, if I probably just say who would like to take this. Otherwise, I'll be going all over the place.
Thanks, Jane. So we've been working really closely with education providers because we understand the challenges that that the COVID situation has created for education provision. We have provided education programs with flexibility to adapt their programs to meet the current challenges. And they can talk us through what their planning is, but ultimately they can, as long as they can assure themselves that their students are meeting or are able to meet the standards of proficiency that we set at the end of their programme, we've given them the flexibility to amend their programmes. The Council of Deans of Health have worked with the NMC and HCPC to generate a statement together which outlines the importance of student progression and a real commitment to ensuring that that isn't hindered as far as possible because of COVID. So what will happen is that final year students will be prioritised in relation to placements, but there will be consideration across all of the different years within the programme to make sure that everybody receives their appropriate placement programmes. So it might not happen immediately, but your university should be supporting you through that and should be open and transparent with you around their plans to support you ongoing.
So obviously she will at some point make up that, you know, those 12 weeks, which is good. So, right, now we'll move on to the question for the NMC. This is from Moira, so this is from a representative perspective. So a Skiffen student member was redeployed onto an acute ward during the pandemic and has been told by their university that their practice hours that they did on that during that time isn't going to count towards their Skiffen competencies, and they're going to have hours to make up in September, which will obviously delay them qualifying. So she's asking, is this right, or is there anything that can be done? Because obviously that student then is at a detriment, and I know from the discussions I was part of, we did say that, you know, no student really should suffer a detriment. But Gerry, I think that's one for you.
Yeah, so a big health warning here. It's always difficult to sort of say what you think when you don't know the individual circumstances. So I think it's right to say that if you've been doing a Skiffen programme and you've not had the experience in practice which you need to get that qualification, then in some respects the university is right that period of time in the acute ward can't count towards your Skiffen qualification. Because it's a bit like saying, do a year's programme in Skiffen, actually, but don't do any time in practice at all. Now, what the universities might do to try and make up for that, or to try and avoid the extension to the programme, as Katherine says, we've tried to make our standards flexible, so they have got time to sort of fit that in. But, you know, the bottom line is, it could be that some people might have to make the time up. And I'm really sorry that's happened to people. I think, you know, what this pandemic has done has upset a lot of plans for a lot of people. We know that student learning will be disrupted. We've tried as hard as we can to put as much flexibility in to make sure that as many people continue their programmes and finish at the time when they're expected to. Mm-hmm. There may be some odd examples when that's really, really difficult to do in order to get that time back to meet the standards that are required. I hope that's not many people. I hope that's not Moira. But there is a possibility that they would have to make that time up if they haven't got the required hours in by the end of the programme. But I think it's worth discussing with the university what some of the options might be, because there is some flexibility in there.
Yeah, that's really helpful. Brilliant. And I know we can't go into too much detail because probably the discussions are still going on, but obviously we're coming to, well, I won't say coming to the end, but we're moving into a different phase now, aren't we? Coming out of maybe the emergency processes. So could both of you just allude to, because I think it's slightly different, is it, for students from HCPC, particularly thinking of those that were in the final year, nursing students. So what do we envisage maybe might happen there? We'll talk about the register later maybe, but maybe just focusing on students. What are the plans now with their programmes going forward? Gerry, do you want to take that first? Is that all right?
Yeah, so the third year students who went into extended placements, and our emergency standards allowed them to do that, we would hope that those who are expecting to finish in September will be able to do so. They need to have done their 4,600 hours. They need to have passed all their assessments. When we put those emergency standards in place, there was an anticipation that quite a lot of students going on to the extended placements would go on those until they finished their course in July and August, and then they'd be able to register as normal. And that was one of the reasons why we didn't set up the temporary register, because we thought there was more of a risk that they wouldn't be able to qualify as normal had they gone onto the temporary register. So we hope for the majority of students, that should be fine. There will be other students, either those who are shielding, those who could not go on to extended placements. We'd hope that their universities can work flexibly, and hopefully they will finish on time as well. That's the third years. You know that we also made some facilitative arrangements for first and second years. They didn't have to do this, but if their universities needed the flexibility, we allowed first years to spend their time in theory and second years to extend their time in practice to 80% and 20% theoretical study. All of those emergency standards relating to removal of supernumerary status will be withdrawn at the end of September. So we've had discussions with yourselves, Jane, our other representative bodies, the chief nurses, the Council of Deans, College of Midwifery, and we all have agreed that removal of those emergency standards by the end of September will hopefully lead us into the next academic year with people going onto more of a normal programme. Because what's really important is that we try and stabilise the student experience and learning as much as we can, because otherwise, the longer these unusual arrangements stay in place, the longer it might take for people to get their course back on track how it should be. So the decision was for September, because that starts a new academic year, leaving one or two standards in place which allow some flexibility, particularly around progression from year to year. And in the hope that we could still cope with what is an ongoing pandemic but isn't quite as acute, and we can keep the students in as normal as an environment as possible.
Is there anything you, from HCPC again, would that be you, Katherine, or Natalie? Yeah. Anything that's different for you or with your students?
I guess the difference to add on that is that we facilitated final year students who'd completed all their clinical placements to be on the temporary register to support the pandemic, and we recognised the challenges around progression through courses and the impact for students. So we are working towards winding that down and so that we can resume a normal process for education provision. So much like the approach the NMC has taken, but in a slightly different manner, because we took a slightly different approach to temporary registration.
Okay, thank you. I've had 2 further questions in about students. So I've got one that will be for the NMC. So one from Vivian that says, I work in the community as a CPN. I'm worried about students going out on home visits. I don't think they should due to the risk to self and clients due to the current pandemic. What are your thoughts on this?
So if they are students, they should still be supervised and supported. And it's really the role of the registrants who are responsible for that supervision and support to make sure that their activities don't stray into something beyond their level of competence. So I think there's a which is part of the reason we weren't sure about the temporary register. These people may be on extended placements. They may be being reimbursed, but they are still students. They don't know any more than they did before. So whilst they're providing support to the workforce, we're really keen that they are still recognised as being students and not being qualified professionals. So they may be doing an extended placement, but we're not extending their competence to go with it beyond what they have learnt already.
And in terms of, I'm not sure if she means in terms of students going out to do visits in terms of putting themselves or clients at risk, but I'm guessing they would be the same as any other practitioner going out. So you do the risk assessment before you go and do visits, because students are still going to need to learn, aren't they? So if they're not shielding, they're not in a high risk group, and risk assessments are done for the people, you know, they're going to visit. I don't know if anything's been decided going forward around how students are going to learn. Are they still going to be able to go, you know, into people's homes in view of the pandemic? I'm imagining they will need to.
I think the issue here is you wouldn't treat that student any different from any other student who you might be saying go and visit a patient who is at risk for some reason. Because don't forget, there is a coronavirus risk. There's always been infection risks of other types. And the registrant who is responsible for supervising that student has always had to take those things into consideration. Now, we know that the risks at the moment are much more dispersed, but it doesn't change that relationship between supervisor and student and risk assessment that you'd expect to be put in place whenever.
Brilliant, thank you. And I've got another one for HCPC. Are you happy with the ambulance now? Is NQP programme, is that newly qualified paramedic programme? Have any issues been raised with you about this? Who would like to take that one?
I mean, I'm happy to take it. As far as I'm aware, we haven't had any direct concerns raised recently, but I'm happy to take it away and double check with our education department if that's
brilliant. Thank you, Katherine. So thank you very much for the question, Steve. We will get back to you on that. Katherine has made a commitment now. Then I've got another one that I'm going to have to read. Now, this one is from Bernadette and joined, I'll have to read it out so I don't miss any bits. Joined as HV programme leader at university. Re-comment for Skiffen hours. That is representative of our entire cohort who have just resumed studies as they were redeployed prior to the assessment period. So they all now need to submit academic work prior to resuming practice. Some were redeployed to community assessment clinics where skills were required that could be transferable. However, to apply this, it would disadvantage students who were redeployed to other acute clinical placements. So that's some feedback for you. I think there might be, so a bit more. They should have been completing in September, but they now won't complete until January. So that's some feedback, more than a question, really. So thank you very much for that, Bernadette. It's useful feedback and shows the impact that the pandemic has had on some people's training.
Exactly. And I think there'll be lots of different examples nationwide. And all universities, what this has really shown is that all universities run their programs in slightly different ways. So there's a different range of issues. So one of the things that we can best do is try and give universities the flexibility so they don't have to stick rigidly within some standards which prevent them from dealing with some of those problems locally. But we're also in constant talking with the Council of Deans, who are bringing to our attention where additional flexibilities might help, and where we can do that, we will.
And it's a really difficult one, isn't it? Because obviously that, the health visiting services would have had, newly qualified health visitors joining in, or school nurses, I don't know what, joining in September, whereas now they're not going to have them until January. So that has, a knock on to the service, doesn't it? So, yeah. Right, we move on to fitness to practice. Now we've got a couple of questions related to that. So there's one question from Sharon, which is for HCPC, but actually I think it would apply to both of you. So in terms of fitness to practice cases, is there a time limit on fitness to practice inquiries? And do the HCPC, but I think also NMC could answer, have the authority to demand the relevant information from an employer in order to conclude a case? So I think this is somebody that, it's a hold up at the employer level. So I don't know if you're willing to answer that one. So.
Yeah,
right. Laura, sorry.
That's all right.
Yes,
I'll tell them
please.
for the HCPC. So in relation to the length of time since an incident took place, there is no time bar on making a complaint to us about an incident. What I would say to that is that obviously the longer ago something occurred, the harder it can be to gather relevant evidence in relation to that matter. And often we find that if something happened over 5 years ago, that tends to present a particular problem. However, we will always do our best to get any available evidence that there is. So we'll always look into anything that raises a fitness to practice concern, but just being mindful that sometimes there are challenges given the length of time that has passed. So we do have powers to require a third-party organisation to provide us with any relevant information during an investigation. And that could include an employer, depending on the nature of that evidence. Obviously, our preference would be to work with another party that's involved in the case to overcome any barriers there might be to providing evidence. We recognise that employers are working under very challenging circumstances and everyone has their own day job to do, and providing evidence for us may not necessarily be at the top of their priorities. So we will always try and work together to assist you, to help us. But ultimately, if we really do need evidence for an investigation, we do have the powers to compel someone to provide that to us.
Because obviously it can be distressing, can't it, for registrants, if that's the final bit of the, what they need to get their case resolved. Yeah, that's difficult. Have you got anything to add to that, Paul, from an NMC point of view?
I think the situation's almost exactly the same as with colleagues at the HCPC. We do have processing times whereby we aim to take our cases from receipt through to a final conclusion in no more than 15 months, and our escalation processes are aligned with that overall time period. So similarly, we don't want to use the powers that we've got, and we very rarely have to use the powers that we've got to compel people to get involved. So what we do have is we have escalation processes that exist with the different organisations that we make inquiries of. And as I say, we try to make those inquiries at the earliest possible point to enable us to complete our cases within that 15-month period.
Brilliant, thank you. And the other one, which again is related to fitness to practice, and again relates to both of you. So are you still taking complaints during this time? And are these being managed in the context of COVID-19? Do you want to start this time?
Would you like me to go first this time?
Yeah, go on, Paul.
Yeah, exactly. So the short answer to the first question is yes, we are still receiving complaints. Our terminology in the NMC is referral, so we still are receiving them. We made some decisions back in March about how we'd go forwards and how we'd progress our casework during the emergency period. So whilst we are receiving referrals, we're not proactively progressing our investigations and our fitness to practice hearings at the moment, because we didn't feel as though the sector and the workforce would be able to support the level of fitness to practice activity that we normally have. So what we've done instead is we've concentrated on work that we think is necessary to satisfy any public protection risks that we might have in an interim period. So if we think that there is a risk, we're applying for interim orders to restrict practice. And if somebody is on a substantive order which is about to expire, we're asking panels to look at those. But generally with everything else, we've taken the approach to minimise the other activity and the other contact that we have with the sector so that they can concentrate on providing frontline healthcare. That will have to change. And I think we're making some announcements today around how we start to re-engage and re-engage sensitively with both individual registrants and with employing organisations. We think that we'll probably start doing some investigation casework as we move through towards the end of July, and we think we'll probably move back to holding some physical hearings at the beginning of September, but only where we're satisfied that it's safe to do so.
Right, okay. Lovely. Thanks, Paul. Laura?
Yeah, so similarly, we've maintained an open complaints process of fitness to practice throughout the pandemic. Slightly differently than the NMC, we've continued to investigate new referrals and ongoing cases that we had before the pandemic as far as we are able to. So there have been some instances where third parties have been unable to engage with us to provide information because of their own pressures as a result of COVID-19. And we are making allowances for that, so extending timeframes and keeping in regular contact, again, trying to assist places to provide us with information where we can. And we also recognise that registrants may find it difficult to engage with us during the fitness to practice process or to seek representation, for example. So again, if registrants are contacting us with those kind of concerns, we're making allowances and providing extended timeframes and negotiating suitable timeframes for our registrants as well during the process.
Brilliant. We've had a follow-on question about this, really. So any complaints about the non-compliance around the wearing of PPE or any particular issues there? Laura, have you? Yeah. I mean, I don't know if you're allowed to say, are you? But
yeah, I can say in broad terms. So we have received complaints relating to COVID-19, and they fall into a number of areas. But one of the areas has related to non-compliance with PPE, and that has tended to be in relation to our registrants that work in the community or self-employed and have their own practice. For example, a physiotherapist who has their own practice in the community. That is just an example. So we have received those kind of complaints. Yes.
Right. What about you, Paul, at the NMC?
We have received complaints along those lines, referrals along those lines.
Yeah.
But I think you touched on it earlier on, Jane. So you mentioned sort of like context in fitness to practice cases. You know, when we're looking at those cases, we will be looking at the context and trying to understand the context in which people were working, and whether or not the way in that we're working was in line with the principles that's set out in the code. So we have had some. I can't talk about the specific details. Sorry,
absolutely.
But context will be key in terms of how we look at those cases.
And I know another issue is social media, isn't it, which has been very busy at this time. So we do advise our registrants to make sure they're up to date with social media guidance. So okay, right. So we move on. So we've got a question from Kelly that says she's been off the NMC register for about 4 years and she needs to work 750 hours to revalidate, which she's not able to achieve by working on her days off. She was able to join the temporary register and would like to know how long it's going to be open for and what happens to nurses who want to get their permanent PIN number back after the crisis is over, because she'd like to be able to find a way to do this without going into financial deficit. Again, a great question, Kelly. Thank you very much. And I think that's one for Linda, is it?
It is. Thank you. Thanks, Jane. Thanks for the question, Kelly. And thank you for stepping up and joining the temporary register. As at today, if people are interested, we've got about 14,100 people on the temporary register. That's going really well. The temporary register was created under the emergency legislation when the Secretary of State notified us that we are in an emergency situation. So it will close when he tells us that the emergency is over. So it's up to him, basically. We are working with the Department of Health and Social Care really closely, because obviously we would like as much notice as possible to make sure we've got the policies and processes in place for the smooth transition and closure of the register, and so that we can notify everybody that's on the register of what's going to happen. So at the moment, no idea when that's going to happen, but I don't think it's any time soon. As we're moving into a different phase of the emergency, obviously there's still a requirement for registrants out there. In terms of moving back to permanent registration, before the COVID, which seems like a whole lifetime ago now, so in January this year, we did actually make it possible for people who lapsed from the register to readmit through the test of competence as well as obtaining their practice hours. So that route's open anyway.
Oh, yeah.
And obviously you need your 750 hours if you've been off the register for more than 5 years. So you would need to obviously be able to add to your current bank of hours with the practice hours that you're clocking up as a temporary registrant as well. So we're looking at ways to be able to support people back onto the permanent register. I think it's just important to say that obviously the standards are the standards, the requirements are the requirements, but what we are looking at in terms of our policy is to see how we can facilitate and support people back on as smoothly as possible.
Yeah, no, that sounds quite positive then for Kelly, maybe some of the things to look at. So, Natalie, I think this would be one for you. Is there any difference in the HCPC process? Have you got plans to support people on the temporary register back into practice?
Yeah, very similar to what Linda said. I mean, it's similar in that obviously we don't know how long we're going to have that temporary register for. Our requirements still stand and returns to if someone wants to come onto the main register, we still have kind of our returns to practice, process in place. If someone's not practiced for, maybe over 5 years, we would still expect them to do their 60 days. We don't have anything like the test of competence like Linda mentioned from the NMC half. Ours would be that return to practice would need to be completed. But obviously, we do know that might be a little bit more difficult given the current circumstances. So there is always consideration for these things, but as it stands, our process is as it is. We still have the temporary register with our registrants on there for obviously the COVID emergency, and our process is just the same in terms of coming back via readmission process and completing that returns to practice. But with that said, what I would say is that depending on how long this goes on for, we may need to look into this again, but it's just so hard at the moment to know how long this is actually going to happen for. So we'll keep it under review.
Brilliant. And a kind of a follow-up question really is to ask, well, both of you really, it's a student asking whether there's any delays in the registration process at the moment in terms of getting on the register, quickly. Natalie.
Yeah, in terms of coming onto the register, onto the main register, we're still working within our 10 working days to get those applications through and processed. Obviously, we had to adapt quite quickly to working from home and taking our processes, and we're not completely online with any of this. We're still quite paper-based. As you can imagine, it's been quite a challenge, but we've managed to stay within our service level when it's not changed. So yeah, we're turning things around as quickly as we can and staying within service. at the moment.
Brilliant, thank you. And Linda, yeah, the same. Oh, Jerry.
Oh, sorry, Linda first.
I'll go to Linda first.
I was going to say, no delays at our end particularly. It was just about getting used to working from home, but most of our processes are online. And as long as there aren't any health and character issues, people will sail through quite quickly. So, but it is
brilliant. Brilliant. Jerry?
Yeah, just to go back to Kelly's question, and this might not apply to Kelly, but a few people that I've spoken to are a bit confused in that you can use your hours on the temporary register towards your 450 or your 750. So if you've been off the register for 3 years, if you do 12 weeks of a 37.5-hour week, that's all you need to get back onto the permanent register. There's also a bit of confusion about revalidation. So you don't have to revalidate, you just have to do the hours.
Right.
If you don't need to revalidate on the temporary register.
Brilliant, lovely. Yes, Katherine.
Just to say that follows for the HCPC as well, and we will be looking at flexibility around the timeframes within which we expect people to have done those hours, recognising that if you weren't able to secure a position under the temporary register, that you would perhaps have extended delays in being able to do practice hours. So there are some flexibilities afforded, but like Natalie said, the requirements to meet the standards are still there.
Brilliant. And we have had a question from Saz, which I think may well have been answered. It's about FTP at HCPC, saying as the pandemic delayed investigations, registrants can no longer contact their case managers by phone. When will registrants be able to speak to their case managers?
Yeah, so there isn't a significant impact in terms of delays to investigations. As I said, we are continuing with them. There has been an impact as recognised in relation to being able to contact us by phone. And that was one of the issues for us in terms of working from home and how quickly that lockdown came into place. The nature of our phone systems in the office has meant we're not able to reroute those calls through to our members of staff who are working from home. So unfortunately, we recognise that at the moment people can't necessarily speak to their case managers. What I would say is that we are able to provide callback requests from staff. We can make those outgoing calls. So if you would like to speak to your case manager, you can send an email to our Fitness to Practice address, which is on our website, and you should already have that if you have an open case, and request that callback and someone will call you. We are also working at the moment in setting up or exploring some online telephony system that would allow us to reopen our phone lines, obviously in recognition that this working from home situation is going to go on for longer than perhaps we might have thought back at the beginning of March. So we are working on getting that back online as soon as possible, because we recognise that that's really crucial, that you should be able to speak to your case manager. But as I say, do put in an email request for a call back and we will call you back.
Brilliant, thank you. And we've got another one for the NMC from Kenga. My 3-year revalidation is due in July 2021. Will the current extension arrangements be extended to registrants who are due their revalidation next year? I'm interested in this because that applies to me as well.
No chance.
No. Oh, thank you.
Thank you for the question, Kenga. I might need to read some of this because it does get very complicated. So the emergency legislation gave us the powers to be able to extend the timeline for retention and revalidation timelines. For those that were revalidating from March through to June this year, everybody had a blanket 12-week extension. So that applied across the board if you hadn't submitted on time. And then those who were due to revalidate from July this year through to September, the 12-week extension will also be available to you, but it'll be an opt-in basis, so you'll need to contact us and ask us for that extension. A second 12-week extension period is available to everybody as an opt-in basis, but you will need to get your confirmers to support that application for an extension and let us know that it was due to the COVID emergency. So that will take us through to September and effectively gives some people up to 24 weeks, basically 6 months, to submit their revalidation, which was in line with what stakeholder feedback was telling us, that should be sufficient to see us over this current period. We're looking at whether or not a third extension is possible or appropriate to be able to give, but we're looking at that policy at the moment. The other bit of the policy we're looking at is looking at whether extensions will be available to those that are due to revalidate after September. So a very long-winded answer to the question is, at the moment, we wouldn't be looking at July 2021. Hopefully we will be in some kind of normal by then, but we will be obviously keeping it under review, because who knows how long this is going to go on for and what the circumstances will be. So I hope that's helpful. And so if you're due to revalidate next year, Jane, you will need to revalidate.
I will have to do it. I need to get on with it. And I think that would be a message. It's going back to when revalidation started. We did a lot of sessions saying to people, try and get ahead of the game. And I, it's been really difficult at the moment, but I think that's probably the message as we start getting back to some normality. There's been so much learning going on through this period. So if you can capture reflections or, learning points, doesn't have to be formal, CPD, now's the time to do it, she says, it's been on my agenda for a long time to do it, and I really must do it. So I'd say the same to members, please try and get ahead of the game. It makes it much easier in the long run. So, and one, again, it's from the Biomedical Science Institute in Scotland. During this time, there's been less opportunity to attend journal club meetings, presentations from internal and external speakers. Will this be taken into account during the next round of CPD audits? That's for Natalie, I think.
Yeah, I'll take that. Yeah, absolutely. I know that, at the moment in terms of CPD, especially with like formal training, for example, could be more tricky. What we would say to all of our registrants is that, CPD is a broad range of different activities. It can be self-directed, it can be online, it can be things that they're doing from home, particularly as they're spending a bit more time at home. So what I would probably advise is our registrants and our biomedical scientists as well to have a look at our list of examples of CPD activities, because what they'll probably find is actually they're still doing a lot of CPD, but it may not just be in a more formal setting. With that said, obviously, if a biomedical scientist or any other profession was selected for CPD, we would, the assessors would kind of take on board that there may be larger gaps or not as much of a mixture, but that can be explained in the profile when it's submitted, and any gaps larger than 3 consecutive months would need to be explained. But obviously a pandemic probably would be a very much justified reason for the assessors to understand. But we would still expect people to be doing quite a bit of CPD around this time, although maybe a bit more tricky to log it because they're probably a lot more busier. So we just encourage people to try and log their CPD as they remember, because it's very hard to remember what you've done last week, never mind over a 2-year period.
And Jerry's just made a very good point, certainly for NMC registrants, and I don't know if it would be the same for HCPC, that actually watching this could count towards participatory CPD as well. So, and I think a couple of things from me. So I think I know the answer already, but I'm going to ask it. With the revalidation date, so if you've had an extension on revalidation, does your revalidation date stay the same as it was originally? Doesn't kind of shift at all. And the same for HCPC with CPD audits. If your audit's been cancelled, does that, if you've got a longer time then before your next CPD audit? I'll let Linda answer first, and then we'll go to you, Natalie.
Very short answer, yes, you're completely right. So if you had an extension either for your retention period or for your revalidation, the period still stays the same.
Stays the same, okay. And what about CPD audits?
Yeah, so any audits that have been cancelled this time round, they've been completely cancelled. So we wouldn't then run another audit for the 2.5% until another 2-year period. So they would remain the same dates, but it would be a new selection of 2.5% of the register for that audit.
we haven't got very long to go. I've got another one, I think, for you, Natalie, from Nadia, asking why it's difficult for applicants to get registered as biomedical scientists at the same time as they register with the Institute of Biomedical Science portfolio. Sorry, it's difficult trying to read the question. Did that make sense or not? Let me read it out. I've got tweets coming as well. So, why is it so difficult for applicants to get registered with the HCPC as biomedical scientists at this time when the IBMS portfolio has been completed and all educational aspects met? Universities are closed, so how can it be expected for them to send pass lists? Hopefully you understand that one.
Yeah, I'm guessing this is someone applying via a UK route to come onto the register as a biomedical scientist.
Right.
And essentially what we need in order to come on via the UK route is to know that you've completed successfully an approved course. So we do require a pass list. For the case of the biomedical scientist, it may be that they've obtained a certificate from the IBMS. So again, they would then provide us with a list of those successful applicants. If we don't obtain that list, we wouldn't be able to put someone on to the register just because we need to know they've successfully completed what is required of them. It's hard because I don't know about this individual case. And
but maybe they can contact somebody to particular issues?
I mean, ultimately, we have to, ensure this person has met our standards before we put them onto the register. So we would need that pass list. So my best advice would be, I know that the universities are closed, but, if there is any point of contact in the institute at all that they could get through to, I know we've had this come up and some applicants have successfully been able to get through. It's just taken a bit of time, but ultimately on our half, we can't relax that just for the fact that we need to know someone's done that approved course before we place them on the register.
We can certainly pick it up with our education department and see if they're aware of anything, and if there's anything that we can do to facilitate, then we will. But I think Natalie's right. It's a delay in another organisation, but we can pick it up with our education department.
I've got one final one asking whether there are any proposals for a fee increase. I think it's directed at HCPC. They're kind of making the point that, they're hailed as heroes, so why would they be asked for more money to register? Yeah. I know we've had that raised, haven't we, before about, would it be possible for the NMC, HCPC to waive the registration fee during this time? I don't know who would like to take that from.
I can
Katherine, would that be you? Thank you.
Yeah. So in terms of waiving the registration fee, whilst we recognise the immense efforts that our healthcare professionals have delivered towards meeting the COVID crisis, we are solely funded by registrant fees, and we have a statutory obligation to set standards, improve education programmes, take action where concerns are raised, and deliver our whole programme of work to support patient safety. So unfortunately, we can't waive the fees as entirely. I'm sure many of you are aware that the HCPC consulted on an increase to our fees fairly recently, and we have been in discussions about reducing the initial proposal that we went out with. We have paused the increase that was planned. I think we are still considering when it would be appropriate to undertake that increase, but we are recognising the impacts that registrants would have felt, and so the planned increase that we were making, we have paused.
Thank you. Anybody from the NMC want to add anything? Or I know Andrea has written specifically on this point, hasn't she, on the website? But
with very much similar to our argument to Katherine, really. I think if the government wanted to waive the fee, then in order for us to keep our activities to ensure patient safety along the lines that Katherine's described, we would need the money to come from somewhere else. However, I can say that we're not thinking of increasing the fee.
That's a bit of good news, thank you. But not putting it down either, which would be helpful. But anyway, that is the last question. You might be relieved to know, but we have run out of time. So that hour has really flown by, and I'd really like to take this opportunity to thank everybody that's watching. Thank you all for your questions. They were really good questions. I hope you feel you've had the answers, but please come back to us if not, and we'll do our best to get you an answer. But I'd really like to thank my panel as well. Thank you very much for coming, for giving your time and answering those questions so well. Thank you to Dave behind the scenes for the technical bit. And we will finish there. Take care, everybody. Look after yourselves, and thank you all for all that you're doing. We're really appreciative. I'll let you all say goodbye.
Thank you.
Bye.
Thank you. Goodbye.
Goodbye.